We have with us a medical doctor and public health expert, Talabi Odunayo. We've been talking, we were just beginning to talk about the health sector financing in Nigeria. It's no longer news. Bill Gates is in was in Nigeria, and he was addressing a lot of things. He, alongside Aliko Dangote, and they were talking about financing in health as well as other things. Now, Doctor, I was asking earlier, what is really the challenge when it comes to the issue of financing health in Nigeria over the years?
As I was saying, that the healthcare system generally in Nigeria is in shambles, you know. But that's not the problem, really, because so many other nations also have their health system in problems. The issue is, what are we doing to correct that? And we really don't need Bill Gates to come and tell us. It's a problem that is with us, that we are living with every day. And financing is a problem. It's an issue in health system in Nigeria. But we need to put it in context. We need to really look at it in the sense that, is it really the money to start with? Sometimes it's not the amount of money. It is the way the money is being utilized. I give you an example. There was a time it was found that Nigeria is one of the most expensive places to give children vaccination. The cost of vaccinating a single child in Nigeria is higher than many other nations. Why? Because if you say you are spending, hypothetically, 1 million in vaccinating children, you discover that half of that money will go into stealing, embezzlement, and all that. The remaining half, when you now get your vaccines, some of those vaccines in some part of the country will be kept under the table to expire, to lose their cold chain, while sometimes in generating data, you give 200 people vaccines and you say you have given 300 and waste the remaining. So at the end of the day, we now ask ourselves, when we say we now need 1 more million to vaccinate the children, do we really need 1 more million, or we need to utilize that first 1 million appropriately? So we need to put that in context.
So in essence, the health sector too is also a victim of corruption we've been talking about in the Nigerian system. Exactly,
it's a major victim, and you know, health is related to everything. The relationship between health and economics has been documented over time. In fact, we can relate with that in the country. We know that the best period of this dispensation, the president spent it outside the country, taking care of his health. So, and it's not the first time we are witnessing that. So we should by now have realized that health is so important that it affects everything. When we can get it fixed, then you have healthy populace to run the economy and other sectors of the country.
All right. We know in the days of late Professor Luko Ransom Kuti, when he was Minister of Finance, primary healthcare, health rather. Primary healthcare was at its best in this country. Absolutely. We saw the impact of that in children and all of that, in vaccination and even awareness generally on the side of people. Exactly. And all of that. At what point did we get it wrong, really, instead of building on what he started?
What Professor Lukoyi was able to do that time was to almost create a parallel fund for health. First, he was given a free hand. He had the will. He understood that primary health care is more important than even building big hospitals. The third thing was that he utilized his funds efficiently. Remember what we just spoke about now. And then he ensured that that fund was managed by people who were in charge, whose health were in question. So when fund comes from the federal government, it goes to the communities where that is to be utilized. Now, the problem we have now is that the federal government sits in Abuja and appropriates funds. They send it to the states, they send it to local government. Now, when there are issues which often occur at the local government level, the local government cannot address that issue without first going to the federal government. I give you an example. There was a time I was part of a team going around health centers in some states. And in Abuja, a particular health center in Ondo was marked as having a functional solar panel to keep their cold chain, their vaccines. By the time we got there, the matron in charge made us realize that their solar panel had stopped working months. Note what I just said. In Abuja, it's recorded that children are getting vaccines in that particular health center. So when we now questioned that woman, she said she had to report to her supervisor, who reports to the local government, who reports to the state, who goes to Abuja.
Wow.
So by the time you complete that cycle, a year has gone, and many children are being deprived of vaccination. So the first thing is that the way the health system is organized, funding is important. Try and get me right. But the way the health system is organized is such that even funds may not help if all you do is increase the fund without strengthening the health system.
The health system.
Yes.
And that is why we understand about at least, Nigeria has at least 30,000 primary health centers, but barely a number of them are functioning optimally, and that is where we are today. And it's supposed to be the centers that they are supposed to be centers that at the grassroots level. So how do you strengthen them now, really? Because many Nigerians are seeking cheaper and even maybe dangerous alternatives to treat themselves.
Let's try and divide the problem into three. The first one is the problem of access. Access in the sense that some people don't have health centers close to them. They have to travel miles to get one. And some of those roads are not even motorable. Access in the sense that when they get to those health facilities, they cannot pay because they have to pay out of pocket, which is criminal. Really, everybody at the point of need for health must get it. Either you have money or not, at that point in time that you need to be taken care of, you must be taken. That is the duty the government owes the people. So access in terms of being able to pay is there. The second problem is that of delivery. Delivery of that health care. First, personnel. Many people are leaving the country. Many practitioners are leaving. The motivation is not there. People are being owed salaries. There are no incentives to keep people on the job. And then, of course, we talk of infrastructure. Infrastructure, electricity, water. Those are things you need to keep a health center running. And then, the health administration, which you mentioned earlier, that how do you administer these health centers? Why not let the communities handle their own health care? Give them the money. Let them handle it. They know what is best for them. The chairman is very close to they can walk up to him and tell him that our solar panel, for instance, has broken down.
And he should be able to fix it.
Exactly. So those are the three problems that we have. And we just need to address those problems starting from access. How do we ensure that people have access to health care? That is the first thing.
Okay. Bill Gates has been in Nigeria for different things, but he met with the government alongside Aliko Dangote. They were talking about healthcare financing, and he was really drawing attention to the need to finance. He revealed that about $1 billion so far his foundation has spent on healthcare in Nigeria, especially when it comes to vaccination, vaccines, and so on. What is really going to change with all of this revelations he has made, and even the call to government to take a look at investment in health?
Well, Bill Gates has the legitimacy to make those statements. He has spent so much in donations, to the Nigerian health sector. And one of the reasons why he was sounding that note of warning is that other donors are already cutting their funding to the country. US used to be one of the largest donors to the Nigerian health system, and they've cut it with the current government. So he is now telling us to look inwards. That's what he meant. Now, why I said at the beginning that talk is cheap. Government can say whatever they want to say. Action is what is important. Let's look at the health bill, for instance, now passed into law. That bill or law already mandated government to remove 1% of the consolidated revenue fund to health. Why is that not being done? That is what we should ask ourselves. Why is it difficult for government to implement that? Seeing that health affects everyone. Politicians, citizens, anyone.
And the African Union, even of which the agreement declaration in Abuja in 2001, which Nigeria signed to, that about 15% should be allocated to health.
Now we are not even up to 5.
13%.
Yes.
Well, the highest so far in Nigerian history was in 2012, about 5.95%. Yeah.
So currently, we don't even have up to 5%. If you look at the new budget that we have. So what the health bill was trying to do then was to say, okay, how do we address these problems? Because they are multifaceted, they are everywhere. That, okay, if we can have a fund that goes directly into health, then that removes this problem of 3%, 4%, because it's like you are removing the money from source and say, let this go into taking care of our health. So when we look at that one, the government now has that role to play in saying, okay, on our own part, let's say, I wouldn't know, I'm not a financial expert, I wouldn't know whether that 1% will be up to the 15% the AU recommended or not. But it's something, and it doesn't subject the health expenditure to the National Assembly. So it goes straight there. Then government can now come and say, how do we now look at health insurance? Because the ways you can raise money,
that's another aspect of
to fund your health, is either through tax, insurance, direct expenditure like government is doing now, and then of course donations from other people. But now what we have in Nigeria is almost 70% out-of-pocket payment. People have to dip their hands in their pocket to pay at the point of accessing health. It's not healthy. Sometimes it puts families' finances into crisis. And then in the case that people cannot go through that stress, or they don't even have the money, then if they don't go to a herbalist or a pharmacist, then they sit at home. And then that now starts giving us these outbreaks here. People are coming down with cholera, the Lassa fever is spreading, because most people with those illness stay at home. They don't go to the hospital. First, they don't have hospital to go. Two, they don't even have money to access that health care.
Is the government even ever prepared, really, to tackle epidemics?
No, we are not. How can you be prepared?
Are there budgets for
Two important problems. No money to handle that. The second thing is that the government that is prepared for epidemic is sitting in Abuja. The places where those things start are several hundred kilometers away. So by the time the government gets there, of course, it will have spread.
Yeah, escalated.
So what we need to do in terms of funds, starting with fund now, is implement that law that says that 1% should be set aside for health. Then start health insurance scheme that will capture more Nigerians.
Oh, you have NHIS?
No.
Or is it capturing Nigeria? Is another question.
NHIS is, we are looking at less than 10% coverage, which means that majority are outside that NHIS scheme. They're outside it. So government should look for innovative way of bringing people on board. Those who cannot pay for health at all, the very poor, must be provided for. There should be a social health insurance that will take care of people who are so poor that they cannot pay.
I would say that the Nigerian government doesn't understand this. If you go to Rwanda, that is their universal health coverage there, a 12-month santé is like that. The poorer the citizen is, the lower the amount is going to pay for health coverage. In fact, healthcare there, the healthcare delivery is so cheap there, even cheaper than transportation in that country. So I was going to say that our government doesn't understand this, that health has a lot to do with the country's economic development at the long run.
Well, I wouldn't know. I'm not in government, so I don't know their level of understanding. But you can also determine this by utterances, by actions. Now, the actions of government now doesn't really show that they really have a deep understanding of how important health is. If they did, they probably do not really understand how to solve it. You know, now, most government sees health as hospitals and doctors. That is the understanding. So if you interview anyone, any governor now, well, most governors, some have understanding and say, what are you doing about health? They can tell you that they built a 100-bed hospital in a place, and then they are buying high-tech machines. Those things are important. We are not saying they are not. What we are saying is that many citizens will not even get to that level.
They can't access it.
They cannot. They cannot. Either they die before they get to the primary health center, they die from complications, from inefficiency at that level, or when they now eventually get to that place you have built, the complication is so much that they cannot even pay for those services. That is if those machines are still working.
Even the processes of getting treatment in government hospitals are so many. Before you get attention, really, you have to go through a long process of registration, blood donation, and all of that.
Of course. That would happen because many people are flooding government institutions. Many people. Because of its relatively cheaper rate of accessibility. Yeah, relatively cheaper. And then, of course, because in those centers, the personnel are overworked. You have a nurse attending to about 70 mothers in a primary health center, for instance. Let's not talk about general hospital, primary health center. And then you want the nurse to administer vaccine, write it in the card of the mothers, then document it. So how do you have data? A single individual doing all that, and then you want efficiency. That may not happen. So what people are now saying is that, I heard, I think last week, that government is saying they want to build 10,000 new primary health centers. The question is, the ones they are built, how functional are they? The other aspect they should have looked into, which they are doing in other Western countries, is that why build health centers now? There are so many private hospitals
that you can partner with.
Almost in every villages, that you can say basic care, malaria treatment, simple ANC can be accessed in those private health centers. When you now have a system in place that reimburses them. So someone can leave his house in 3 minutes. He or she in the hospital. Private hospitals are even more ubiquitous than primary health centers. They are everywhere. So governments can key into that. The money they will use to build those 10,000 health centers and then enrich some people, why not use it to design a system that will say, if you have malaria, you have this, you have this, then go to the nearest hospital to you. It doesn't have to be a primary health center. And then you form a partnership. They are there. Those facility structures are already in place. So they can do that.
In fact, that seems to it could be cheaper than setting up
of course
PHCs.
Far cheaper. The facilities are there. Most people don't access those. You and I, if you have malaria now, the tendency is to go to a private hospital. You want to quickly go back to work and all that. How many of us will go and queue up in a general hospital and want to access health? Except it is the only place you can get that kind of services. So and some of those private hospitals are even underutilized. I'm talking of those manned by qualified doctors. In fact, sometimes some doctors favor private practice. I'm talking of those that work in government and have they favor it because they make more money, they see less patients. So now, why can't government reroute some of those patients into those private hospitals and then make your health insurance robust so that with 500 naira, 1,000 naira, many patients will access health. And I'm talking of qualitative health because it's these same doctors that you go and see in those general hospitals.
Thank you very much.
All right, we have to leave you here now. Medical doctor
Odayo Talabi, public health expert. Thank you very much for coming on to the show.
Thank you for coming.
Thank you for coming.
Yes.